Greetings, my name is Helene Filipe, a Portuguese ophthalmologist practicing in Lisbon, and I am very honored to serve the Ophthalmology Foundation as chair for the CPD subcommittee. And one of our two current main goals is group mentoring. We combine group facilitation with peer mentoring to support the collective design project of a group, society, or college that share a mutual goal to overcome an identified problem approachable by education. And today it is my great privilege to introduce Dr. Isra Muhammad, the person who is since the start at the forefront of the retinoblastoma awareness and national integrated approach, RANIA, the acronym for the name of this project. I would also like to introduce Dr. Swati Kaliki, the head of the Eye Oncology Department of LV Prasad Eye Institute, and also Dr. Anthony Vipin, Director of the Service of LV Prasad Eye Institute. So thank you so very much all for accepting to join today. And I would like to start by start our conversation with Dr. Isra, and starting to ask Dr. Isra, please let us know a little bit more about you. You are a colleague of ophthalmology, working in Sudan, practicing in Sudan. Please tell us about you a little bit more.
Thank you very much, and it's a pleasure seeing you and meeting you, Dr. Helena. I am Dr. Isra Muhammad from Sudan. I have been an ophthalmologist since 2008, and I have been working in the field of ocular oncology and orbit since 2010. Across our practice, we came across so many cases of retinoblastoma. We have patients in advanced stages. We have patients dying. We have patients with extraocular disease, and we have so little to do so as to help them to save their lives rather their sight. Since 2015, I have been started to think about how can we improve this? What can we do to save patients' life, to save patients' sight, to implement a protocol for retinoblastoma patients, to share awareness, and so on. My first workshop actually was at 2016. I have an awareness workshop among Sudanese ophthalmologists, and we invited histopathologists and radiologists and epidemiologists, and we started to make some discussions about how are we going to improve the outcome. After that, I began looking for a fellowship so as to be specialized in this field, and a generous opportunity was delivered by the International Council of Ophthalmology and Eye Cancer Foundation. And I have my fellowship at King Hussein Cancer Center at Jordan, supervised by Dr. Yaqub Youssef. He was a great supervisor, and he's running a great team. And the amazing outcome they have there for their retinoblastoma patient was a great inspiration for me to come to Sudan and try to start something like this. And then the COVID-19 epidemic started, and the whole world went in a state of freezing. And by chance, I was invited to a Zoom of mentorship of the Ophthalmology Foundation one day. And that was the start. It was, to that day, it was just a dream. And I feel like I was dreaming alone. I don't know where to start or what to do, honestly. And it was a dream that haunts you. Like you are always thinking of what next, but you don't have the clue of what is going to work. But I was very lucky, very, very lucky actually. And I feel blessed because since then, I feel like I am surrounded by friends, helpful, supportive, and kind, and things are getting better and better, really. So here we are now.
So this is a comprehensive project that you are leading with an engaged team, sharing this mutual goal of minimizing the impact of retinoblastoma, of diagnosing earlier, and also to do that by bringing the concept and the disease explanation to the parents, and trying to diagnose and spreading the what the disease is about and what is needed to know for the parents to bring their children in, and also engage eye care professionals, including ophthalmologists, of course, and other allied personnel, to work together to diagnose earlier, to treat better, and have better patient outcomes in terms of great impact in the lives of the families and the society, as you explained so well. So it's an honor to be here. It has been since the beginning, and your joy and determination and engagement is quite persuading and quite inspiring for any one of us. Thank you so very much. And we are here to walk together and to, just continue to see the good results that we have been seeing. And we have already spoken about some, the intermediate term goals, as you have showed, in terms of establishing a national protocol of retinoblastoma screening, referral, treatment, and follow-up. And you are very clear about this, all the team when wrote the project management plan, and also to establish the curriculum for retinoblastoma screening, training course for healthcare, eye care workers, including ophthalmologists as allied personnel and technicians, and also to involve the public and patients. In this case, it's more the parents into this cause to make earlier diagnosis and to treat better when this disease is diagnosed, hopefully in a younger times of life of the patients. So thank you so very much for being here, for accepting this invitation to explain your project to the Ophthalmology Foundation community. And I would challenge that in no less than 6 months, we could come again and hold a second conversation that would make the Ophthalmology Foundation community aware of this amazing project that you are leading in Sudan.
Hello everyone, I'm Dr. Swati Kaliki, Head of OEU Institute for Eye Cancer, LV Prasad Eye Institute, India. It gives me great pleasure to collaborate for development of National Retinoblastoma Program in Sudan, along with Dr. Isra Mohammed from Mecca Eye Complex, Khartoum. We are grateful for the support received from Ophthalmology Foundation and Dr. Filipe for bringing us together and helping with this collaboration. Together, I'm sure we can build a great retinoblastoma program for Sudan. Looking for great work at Sudan in the future. Thank you.